Hi, my name is Dr. Ilya Skolnikov, and I'm an expert at helping people with chronic fatigue syndrome, fibromyalgia, and fibromyositis. Three things which are very similar. Do you ever find yourself having a lot of pain? It's kind of a silly question, but do you suffer from pain all over your body? Do you ever wondered why the pain is everywhere? Seriously, have you ever just wondered a little bit about it? If you have pain on the right side of your body and the pain is on the left side of your body, or the pain is above your waist and below your waist, if the pain is everywhere, you might kind of think maybe this is a systemic thing, meaning maybe it has to do with your entire system and it's not just something related to an accident or an injury or something like that. Speaking of pain, do you suffer from neck pain by any chance? Do you have pain that's been lasting either in your neck or in your shoulders or in your low back or your upper back? Has the pain lasted for more than 6 or 7 months? Has it even been going on for years? Is the pain not just in one part of your back necessarily, but maybe in a couple of different areas of your back? If so, I'm sure you're a bit frustrated by now and you're not sure where to turn and it's upsetting. Well, what if you didn't have to have all of these pains? What if there was a solution? You've probably tried a bunch of different things. You might have been to a number of different medical doctors. Maybe you've even been to some different holistic healthcare providers, a little bit like myself. Maybe you've seen a naturopath. Maybe you've seen a homeopath. Maybe you've seen a chiropractor. Maybe you have a favorite acupuncturist you've gone to. Maybe you regularly go and get massage. It could be that you are a big fan of physiatry, or you have a holistic MD that you see that gives you lots of nutrients, or somebody who's similar to a nutritionist. It's even possible that in combination with a couple of different things, you also see a psychotherapist or a psychiatrist or a person who's a social worker or something of that nature. Do you ever wake up in the morning more tired than when you went to sleep the night before? Do you ever find yourself reliant on medication? Do you ever literally cry or feel like crying? You're so upset about your condition. Have you ever had a blood lab diagnose you with Lyme's disease or with Epstein-Barr virus, or show that your thyroid levels are off perhaps? Does any of this sound familiar to you? It should, because these are the things that people who suffer from fibromyalgia or chronic fatigue syndrome suffer from. If you go if you check on the internet and go to some really popular websites that talk about chronic fatigue syndrome and fibromyalgia, you will be so lost that you'll never find your way home again. You'll begin to think that your fibromyalgia isn't something that can be treated, that you can find certain lab markers that show that perhaps you have inflammation in your blood that's led to C-reactive protein being high, or there's this protein, or there's substance P is too high in your system, and that's the problem. And oh my goodness gracious me, oh my. No wonder so many people are suffering from these kind of conditions, because they don't know where to go to get the help that they need. See, in our office, you don't have to deal with going to the chiropractor and going to the homeopath and going to the medical doctor and going to the psychologist and going to the acupuncturist and going to the massage therapist and then going and seeing your favorite energy medicine person who you just found out about recently and they do Reiki and you feel much better afterwards. You don't have to deal with that stuff anymore. You don't have to deal with the craziness. Why? Because we do all those things in our office with almost every single patient every time they come in. I myself suffered from chronic fatigue syndrome for quite some time. I had fibromyalgia. I had pain over here and over here. I woke up in the morning more tired than when I went to sleep at night. I took a handful of pills to wake up. I took a handful of pills to go to sleep at night, and a handful of pills to keep me functioning throughout the day. I had cloudy thinking. I was depressed, but didn't tell anyone about it. See, fibromyalgia is serious. 5 million people in the United States have fibromyalgia. It affects a lot of people. Actually 80 to 90% of the people who are affected by fibromyalgia are women So exactly what I wanted to know when I had my fibromyalgia, and the way I got better was this. I wanted to know what was causing my fibromyalgia. It was Hippocrates, 1500 years ago, actually 2500 years ago. He said, the highest good is to find the cause. Let's not just treat the symptoms. You could treat your symptoms all day long with all these different healthcare providers, and your symptoms may go away. Your chronic fatigue may get better, or your fibromyalgia pain may go away completely. But if you're just treating symptoms, the pain will come back. And if not the pain, some other nasty thing will rear its ugly head. So I would want to do what Hippocrates talked about. Find the cause of my health concerns. And I found somebody who had special training and special skills that allowed him to understand the different interrelationships in the body. Did you know that each muscle in the body is related to a different organ and or gland? And did you know that those organs and glands are related to different emotions? And that those organs, glands, muscles, and emotions are related to different traditional Chinese medicine acupuncture meridians? And those organs, muscles, glands, and traditional Chinese acupuncture meridians are related to different nutrients. And they're related to also different herbs and different colors and different sounds and different chakras, which come from Indian medicine. I had no idea, but now I know all kinds of stuff about it. I'm like one of the leading experts on the planet in this area. So here's what you might want to know. If you suffer from chronic fatigue syndrome or fibromyalgia, what does your family need to know about fibromyalgia? What should you know about your own fibromyalgia? Your family should know that you don't have fibromyalgia anymore. Okay. What you should know about your fibromyalgia is that it doesn't need to be yours. You can give it to someone else and no longer have it. Or you can just release it from your system and rid yourself of it and not give it to someone else. You can be free of the craziness, free of the headaches, free of the worry, free of the fatigue, free of the foggy thinking, free of this for the rest of your life. Because you can know exactly what caused it, how to get rid of it, and how to keep it from coming back. We're an expert. We've helped people with this for over 10 years. I had this one patient, his name was Bill. I'm not going to say his last name. But he came in and he was just foggy. He couldn't concentrate. He couldn't think right. He was exhausted all the time. And I started treating him. I treated him a lot. I treated him almost every day for about a week or a week and a half. And we treated some infections. And after about a week and a half of lots of lifestyle changes, lots of treatments, lots of homeopathic remedies, lots of chiropractic adjustments, he was good. He was thinking clear. He was happy. He was in a good mood. But we found a pattern that was happening with his health. I'm like a puzzle solver, and my patients are like the puzzle that I solve. We found a pattern, and that meant that we could get to the right starting point. Because if you don't get to the right starting point, you're just going to do the same thing over and over again, but expecting a different result. And as you know, the definition of insanity is doing the same thing over and over again and expecting a different result. We need to break that way of doing things and do things differently. These holistic therapies work, but you need the right system. You need somebody who has the right training, who has the right skills, who gets the right results. It's not coincidental. It's not a random healing that happens in our office. There's training. It's taken me over 14 or 15 years to learn what I know and do what I do. So thank you so much for listening to this video, and we look forward to seeing you soon.